That's really important work. And a lot of what I've done has been in cardiovascular risk factors. And so we have seen that especially Black and Latino participants, at least in the US, seem to have higher prevalence of a lot of cardiovascular risk factors like hypertension, diabetes, and obesity. And we see that there are like differences in neuroimaging where like Black individuals tend to have more cerebrovascular disease. And so I think that there are some indications that there are definitely differences in risk factors that are kind of patterned the same way that we see like disparities in dementia outcomes. And I think the real challenge is kind of going beyond that and understanding how racism, how like people's cultural identities, how that really shapes their risk factors over their life, and then ultimately leads to different dementia outcomes and how best to intervene and where to intervene. So I work with the Life After 90 study and a couple other studies out of this same Kaiser. They're different cohorts, but they're all out of Kaiser. And so there's a lot of information from like medical records and historical like paper records that have been digitized. So we have some life course exposures that we're really interested in looking at to get a really like a better picture of kind of the entire life course and not just kind of midlife or late life outcomes.